My name is Tom Coons. My symptoms started probably about 20 years ago. I've always had sort of lower back pain, but I've always lived with it, never had a problem. And then about a year ago, I started having my legs go numb, my legs and my feet, and then my hips. And I got to the point where I wasn't always sure I could make it back to the car. If I went to a supermarket and parked or something, I would halfway to the store, my legs would go numb and I'd have to sit down and rest before I could go on. One day I was working out at the gym and I stepped off the treadmill and I couldn't tell which way my legs and hips went numb while I was walking on the treadmill. I couldn't tell which way my ankles were pointed. When I stepped off the treadmill, I was on the side of my foot and I fell down. So I pulled myself up with my hands on the treadmill bars and I thought, I've got to go see a doctor about this. This shouldn't be happening. So I went to see my local doctor in Cambridge, California, and he said, well, you know, I'll refer you to a physiatrist, which I'd never heard of before. And I went to see him and he ordered up an MRI and said, well, it came back that I had very severe spinal stenosis at L4 and 5 and L3 and 4. So he recommended a surgery. He said he didn't have any shots or any magic stuff that would help me. So my brother's a doctor and he said, well, if you're going to have a spinal surgery, I know the guy, Dr. Mork. And last November, I had my first operation on L4 and 5 and it was just magical results. It was incredible. I could walk again, I could even almost run. I didn't have to worry about anything going numb and falling down on the way to the store or anything like that. So I'm back today for my second one at 3 and 4, my second surgery. And I think it's amazing. You know, you don't really have to take a total general anesthetic. So the nice thing about it is you're awake the whole time. They pack you up on a table and face down, and then they clean you off and give you some local anesthetic. So you're awake the whole time. I didn't experience any pain at all through the whole thing. And when I got up, it was just better. And they gave me some pain pills to take if I needed it, but I took one just to stay ahead of the pain, which they advised me to do, but I never had to take another one, not an aspirin or a Tylenol or anything. So I never had any pain at all, just a miraculous result. I highly recommend it to anybody that has the problem.